Hello, everyone. Welcome again one more time. I'm Mustafa Murayati, a sixth-year medical student at Baghdad College of Medicine. Today, I'm going to present a lecture about the arterial supply of the brain. Well, it's going to be a basic anatomy regarding the vascular supply. And we will talk about a concept that you may hear it the first time in your life, the supratentorial arteries. Well, the supratentorial arteries are the arteries that lie above the tentorium cerebelli that separates the brain from the cerebellum. So anything above it is called the supratentorial area, and we will talk about the arteries there. The content of this presentation, first of all, we will have a general overview on the supratentorial arteries, and we will talk about the anterior circulation, the circle of Willis, the anterior part of it, including the ICA, the middle cerebral artery, anterior cerebral artery, and the posterior circulation, including the posterior cerebral artery and the posterior communicating artery. And finally, we will have an interaction part between me and you, and I hope you can interact with me and answer some questions in angiography. I'll show you some imaging and you're capable of answer. Okay, let's start now from the very basic anatomy. You may have heard of it or not. The circle of Willis, the main blood supply to the brain. It lies at the base of the brain. Here, the green outline here represents the circle. This is the circle of Willis. Well, let's know what it consists of. It has two internal carotid arteries, and then the internal carotid artery gives rise to the middle cerebral arteries, which goes laterally. And then we have two anterior cerebral arteries, which goes medially and anteriorly. And between the two anterior cerebral arteries, we have the anterior communicating artery. That was regarding the anterior circulation or anterior part of circle of Willis. Now, regarding the posterior circulation, we have the basilar artery, and it gives rise to the two terminal branches, the posterior cerebral arteries from the basilar artery. And then we have a branch that communicates the anterior and the posterior circulations called the posterior communicating artery. Indeed, this branch is coming from the internal carotid artery, passing posteriorly, medially to join the posterior cerebral artery. Okay, that was the main concept of the circle of Willis. Let's have a view on the circle of Willis in situ. I told you earlier, the base of the brain. So this is the frontal lobes. This is the temporal lobes. Here, the right temporal lobe, the anterior part of it has been cut to show the middle cerebral artery passing in the Sylvian fissure. The Sylvian fissure lies between the frontoparietal lobe above and the temporal lobe below. So we are looking here from inferior surface. This is the base. Okay, here are the two internal carotid arteries, and here are the two middle cerebral arteries going laterally to supply the lateral convexity. And here are the two anterior cerebral arteries in the green, goes anteriorly and medially. And here's the ACOM. This is the two vertebral arteries. This is the basilar artery in the front of the pons. And here are the two PCAs. And this is the PCOM. Okay, now we finished the general overview on the main supratentorial arteries. And now let's start from the heart, how the blood comes from the heart, reaches the brain to supply it. Well, from the heart, from the left ventricle, pumps the blood to the aorta. We have the aortic arch. So this is the aortic arch. On the right side, it gives rise to the brachiocephalic trunk. And we have two subclavian arteries on the right side. The right subclavian artery arises from the brachiocephalic trunk, while on the left side, it arises as a separated branch from the aorta. And then we have two common carotid arteries. The right common carotid arises just as for the right subclavian from the brachiocephalic trunk, while the left one arises from the aortic arch as a separate branch. And then the common carotid arteries in the neck will divide into internal and external carotid artery. The internal carotid artery will supply the brain and the eye, and which will give rise to the circle of Willis, while the external carotid artery, which will run superficially to supply the head and neck structures. And then we have, this is the circle of Willis, our friend. We will talk about more details in this presentation later on. And here are the two middle cerebral arteries, the two anterior cerebral arteries, and that was regarding anterior circulation. Now, the posterior circulation, which is also called the vertebrobasilar system, we have two vertebral arteries coming from the subclavian arteries, unite in front of the pons to form the basilar artery, which give rise to the two-terminal branch, the PCAs. That was from the heart. Now let's move on more up, more distally in the neck. So this is a dissected neck on the right side. We can see this is the common carotid artery. And here's a bifurcation into internal carotid and external carotid artery. The bifurcation lies approximately between the C3, C4 vertebral level posteriorly or the thyroid cartilage anteriorly. The ICA will goes inside the skull, as we mentioned, to supply the brain and the eye, while the ECA over here in the head and neck structures. Now moving more upward, reaching the base of the skull, here we have a foramen or a canal, which is called the carotid canal, at the base of the skull in the petrus part of the temporal bone. So here's the temporal bone. This is an inferior view of the skull. This is the maxilla. This is the foramen magnum. Okay, so this is the carotid canal in which the ICA, the internal carotid artery, will pass. Indeed, let's see the course of the ICA inside this canal. Let's imagine this is the ICA, and we will talk about the segment of the ICA, starting from the first one, the cervical segment in the neck. And this ring, the black ring here, the first one, represents the carotid canal in the petrus bone. When it enters into the canal, it turns into a horizontal direction. So it starts from vertical direction in the cervical segment, then it changes the direction into a horizontal, then it comes vertical one more time. So this is called a petrus segment in the petrus part of the temporal bone. And then we have here is a cavernous segment, and then we have the supraclinoid segment. These are all segments, the four segments of the ICA. And here are the two terminal branch, the MCA and the ACA. We will talk about them in details. Okay, this is one more illustrative picture. This is an anterior view. This is the occipital bone over here. This is the anterior ring of the C1 vertebra to have an orientation about the anatomical view over here. This is the ICA, this is the cervical segment. And here's the ring, this is the carotid canal and the petrus bone. And this is the petrus segment of the ICA. And after that, it comes out intracranially. This is the cavernous segment. And this is the supraclinoid, the last segment. We will repeat them later, but to have an orientation about the course of the ICA, how it goes in the neck to the inside the bone of the skull, and then intracranial. Okay. As I mentioned, there are many classifications to segment the ICA. For example, Roton described 4 segments for the ICA, from C1 to C4, from proximal to distal. C1 is the cervical segment in the neck. C2 is the petrus segment in the petrus part of the temporal bone. C3 is the cavernous segment in the cavernous sinus. C4 is the supraclinoid segment. And more details to be added here. The C4 segment has 3 segments inside it. We will talk about the details of them later. Okay. Other classification, for example, the Boothler described 7 segments from C1 to C7. We will not go into the details of this classification. Other classifications, just to have it in your mind, may start from C1 distally to C7 proximally. And we will stick to the Roton classification of the ICA. Okay, now we followed the ICA from the heart to the neck to the base of the skull, in the skull, in the petrus part of the temporal bone. And now it comes out from the petrus bone, from the foramen lacerum, as the cavernous segment over here, and goes and curves posteriorly and medially, just medial to the anterior clinoid process. After this point, it's called the C4 segment, the supraclinoid segment. Supraclinoid means above the clinoid. What is the clinoid? It is the anterior clinoid process of this sphenoid bone. So just for the anatomical orientation of the naming of the segment. Okay, one more time, let's see the ICA. This is a lateral view. and this is the anterior view. The C1 cervical segment, C2 the petrus segment, see how the curvature and changing the directions. C3 is the cavernous segment, it has this bump anteriorly. C4 is the supraclinoid segment, and the final divisions, terminal branches. The biggest division is the MCA, and the smallest is the ACA. I mentioned earlier the C4 segment, the supraclinoid segment of the ICA has three more divisions or segments inside. Starts from the ophthalmic segment. It's called ophthalmic segment here in the blue because it gives rise to the ophthalmic artery. And then we have the communicating segment, which gives rise to the posterior communicating artery. This is the branch in yellow, which goes posteriorly, as I mentioned, to be joined by the posterior cerebral artery from the posterior circulation. And then we have the green segment here, the choroidal segment, because it gives rise to the anterior choroidal artery. So these are the three segments of the C4. Now, the branches of the supraclinoid ICA, we mentioned them, the ophthalmic artery, the posterior communicating artery, the anterior choroidal artery, and the final two terminal branches, the MCA and the ACA. Now, we will talk about each artery of the cerebral arteries, the ACA, MCA, and the PCA, and show the distribution, the territories to be supplied by these arteries. Let's take the lateral view, medial view, and the coronal view, and discuss the territories to be supplied. We will start with the MCA, the middle cerebral artery. It's represented in the green area over here, supply the lateral convexity, lateral surface of the hemisphere. And for example, let's take the ACA now. The anterior cerebral artery supplies mainly the medial surface of the brain and anterior part of it, because the posterior part and medial surface is supplied by the PCA. But also, if you can see here on the lateral surface, there's a strip around the area supplied by the MCA, which is also shared by the ACA anteriorly and the PCA posteriorly, here in the yellow and blue, in addition to the green. So there is also a strip of area to be supplied on the lateral surface of the brain, other than the MCA. This area indeed is called the watershed area. Maybe we will talk about it later in other presentations, just to keep it in your mind. This is the coronal section. The green area represents the MCA supply, the lateral surface, the anterior and medial surface in the yellow supplied by the ACA, and posterior and medial surface is supplied by the PCA. These are the main cerebral arteries. Okay, let's start now with the middle cerebral artery. We mentioned it earlier, from the two carotid arteries, the ICAs, we have the biggest terminal branch, which is called the MCA, which goes laterally to supply the lateral surface of the brain. The MCA has four segments, four divisions. Okay, let's start from the ICA. Here, the M1 segment, which is called the sphenoidal segment. So this is the sphenoidal segment. It's called the sphenoidal segment because it lies just posterior to the sphenoidal ridge. Okay, so every naming you may hear in anatomy, it's related to anatomical points. So to make it easier to be identified during surgery, for example, if you identify the sphenoidal ridge, you may say for sure this is the M1 segment, the sphenoidal segment, which lies just posterior to it. So the M1 segment of the middle cerebral artery may bifurcate into a bifurcation, and some variations tells that maybe trifurcation or four bifurcations, and maybe multiple bifurcations. So, but mostly it is a bifurcation into superior trunk and inferior trunk. So this is the M1 segment. The M2 segment, it's called the insular segment. You should know from previous presentations we had, here is a structure called the insula. It lies just deep into the sylvian fissure. If we open it, we can see the insula. So the M2 segment lies over the insula. Then we have the M3 segment, the opercular segment. Well, the opercular means the lips of the brain. The lips, I mean the fronto-parietal opercular superiorly and the temporal opercular inferiorly. The artery passes above it to go from the inside the brain to the outside surface is called the opercular segment. And then the cortical segment, the M4 segment, which lies on the surface externally. So these are the 4 segments of the middle cerebral artery. One more time, this is one of our friends has drawn it. It's a really nice drawing. This is the ICA. This is the M1 segment with the bifurcation. This is the sphenoidal segment. And then we have, this is the insular segment. And then this is the opercular segment. And this is the cortical segment. You can see here a little bit the Sylvian fissure has been opened. One more picture. This is the coronal section. This is the left ICA. This is the M1. M1 divides into superior division and inferior division, or trunk. This is superior view. This is the ICA. This is the M1 with its divisions. This is M2, M3, and M4. Well, you can see the M1 starts as a horizontal pathway, then the M2 change into a vertical pathway, the M3 horizontal one more time, and M4 goes vertical one more time. So every time the segment has changed, it changes its direction. So for example, the M2 segment is the insular segment is vertical, while the opercular segment is horizontal. The cortical segment is vertical also, or comes horizontal. This is a coronal section showing this is the M1, M2, M3, and finally M4 segments. Well, I'm not going to go deep into the details of the supply to each area of the brain on the lateral surface, but let's mention this concept. There are 12 surface area to be supplied by the MCA. We mentioned that the M1 segment divides into superior trunk and inferior trunk, or sometimes trifurcation, 3 divisions. But mostly the upper trunk will supply the upper 6 areas represented here, and the lower segment or lower division or lower trunk will supply the lower 6 areas represented here. Okay, starting from orbitofrontal, prefrontal, precentral, central, anterior parietal, posterior parietal, angular, temporooccipital, posterior temporal, middle temporal, anterior temporal, and temporopolar. These are the 12 areas to be supplied by the MCA, the middle cerebral artery on the lateral surface. Each area has what we call a stem artery. A stem artery arises from the division or the trunk, either the superior trunk or the inferior trunk of the M1 segment, and then goes specially to that area to be supplied. That's the details out of spectrum of our presentation now, but just to mention. Okay, now let's talk about the anterior cerebral artery. After we have finished the course of the MCA, let's talk about the ACA from the ICA. With the other terminal branch, the smaller in diameter in relation to the MCA, is the ACA, which goes medially and anteriorly. And we have 2 of them for sure, and they are connected to each other by the ACOM. So the ACA has 5 segments. Let's follow them. Here's the ICA, and then we have the A1 segment. The A1 segment, also called the proximal segment or the proximal ACA, or also called the pre-communicating segment because it is just before the ACOM, the anterior communicating artery. So it's also called the pre-communicating segment. This is the ACOM. And then we have, this is the A2 segment. It is called infracallosal segment, A3, the precallosal, A4, supracallosal, and A5, the posterocallosal. As you can notice here, it's all from A2 to A5 called something callosal, infra, pre, supra, posterocallosal, and in relation to the corpus callosum. So this from A2 to A5, the ACA is called pericallosal. It's round about the corpus callosum, and we will see in the next slide. This is also the contralateral ACA. Look at the curvature of the ACA, just like someone who's wiping the head, his hair. Okay, this is the ICA, and this is the ACA rounding about the corpus callosum. This is the corpus callosum. So starts from here. This is the ICA. This is the pre-communicating segment or the A1 segment. This is the ACOM. This is A2. It's called infracallosal. So this is the corpus callosum. It is inferior to it, infracallosal. This is precallosal, anterior to it. anterior to the corpus callosum. This is supracallosal. Above it, this is posterocallosal, just posterior to the posterior part of corpus callosum. This is also one of our friends has drawn it on paper and pencil. Nice drawing to illustrate here. This is the distribution of the anterior cerebral artery on the medial surface of the brain. So it's applied the anterior part of the medial surface and a little bit on the lateral surface. Just as for the middle cerebral artery, we mentioned some complex details. Also, the ACA has maybe 8 areas or more distribution areas to be supplied. We mentioned on the medial surface and a strip on the anterior part of the lateral surface. Now let's move on to the posterior circulation. And we mentioned earlier the origin from the 2 vertebral arteries unite in front of the pons to form the basilar artery. And then the 2 terminal branches of this artery is the PCAs. We have on the right and one on the left. And then anteriorly, we have the ICAs, and we mentioned the ICA gives rise to the posterior communicating artery, the PCOM. Now, let's have an overview about the PCA. It has 4 segments, just as for the MCA, while the ACA has 5 segments. Okay, here, this is the basilar tip and the 2 terminal branches, the PCAs. The first segment is the P1 segment, just as for the ACA, it's called the pre-communicating segment. Before this one, the yellow artery, the posterior communicating artery coming from the ICA to join the P1 segment to form the P2 segment. So the P2 segment has blood supply from the P1 segment and the PCOM from the ICA. Okay, the P2 segment also has 2 segments within it in relation to the anatomical relation to the cisterns around the midbrain. You can see here is the midbrain. This is the crus cerebri, the right side, and this is the left side. Here around it, we have cisterns that are filled with the CSF. The first one is called the crural cistern. So the P2, which passes in the crural cistern, is called the P2A, or the crural segment. And then here we have the ambient cistern, just posteriorly and distally. This is called the ambient cistern, and the P2 passes within it is called the P2P, P2P. And then more distally, posteriorly, in relation to the midbrain, we have the quadrigeminal cistern over here. So this segment is called the quadrigeminal segment, the P3, and then the cortical branch is the P4. One more time, let's review. This is the midbrain. This is the crus cerebri on the left. This is on the right. And this is the basilar tip giving rise to the P1 segment. So this is the P1 segment. This is the PCOM coming from the ICA. This is the P2A in the crural segment, a crural cistern. This is the P2P in the ambient cistern. This is the P3 in the quadrigeminal. And this is the P4, the cortical. One last time, this is the basilar tip, P1, PCOM, P2A, P2P, P3, and P4. This is the distribution of the PCA on the medial surface and posteriorly. And here are the cortical areas to be supplied by the PCA, medially, laterally, posteriorly. Well, now I hope one of you to focus with me, and I may ask, and he can open the mic and answer freely. Let me give you an orientation about this image. We have the ICA on the left side. This is the right ICA. Here we have the MCA going laterally into the Salvian fissure. So this is the temporal lobe. This is the frontal lobe. This is the ACA medially, and this is the ACA also. This is the ACOM communicating between them. Okay, anyone can tell me what does this star represent? Yes, please. I hope any one of you can make an imagination and tell, even if it's not correct.
May I answer?
Yes, please.
This is a posterior communicating, a fetal posterior communicating artery.
Yeah, exactly. This is a posterior communicating artery. Thank you, Mahmoud. It's originating from the ICA and going posteriorly and medially to join a branch from the posterior circulation, which is called the PCA, to form the P2. We mentioned it. So this is a PCOM. But if you can see on the right side, it is too small. Well, on the left side, it's too big. This is called a fetal PCOM. And if we relate the PCA, it is vice versa. The right side is very big, while the left side is very small PCA. This condition called the left fetal PCOM, in which in utero, the fetus main blood supply to the brain going from the anterior circulation from the ICA. Even the posterior circulation originated from the PCOM, and the PCOM continues as the PCA to supply the posterior part of the brain. While in adult life, this should be shrinked and it's replaced by the basilar or vertebro-basilar system to give rise to the P1. And then the P1 had small or a little contribution from the PCOM to continue as the P2, then supply the posterior circulation area. So this is called a left fetal condition, left fetal PCOM. Okay, now we have reached to our last topic or last section in this presentation, the angiography. We have many types of angiography. I'll mention some of them, and I hope you to be interactive with me. I'll ask some of you. So this is called a conventional angiography, catheter angiography, in which a dye has been injected intravenously and an X-ray shot has been taken to show the vascular supply. Anyone can tell me what is this structure, black, this serpentine structure? It should be too easy. You should all answer. This is the brain, and this is a major vessel in the black. Yes, please. Don't be shy. Either you haven't understand anything or you're too shy to share your information with me. Okay, this is the ICA. This is the internal carotid artery running in the neck, reaching the base of the skull, and then entering into the supply the brain. We mentioned supply the brain and the eye. Here's the ophthalmic artery going to the orbit with the optic nerve, and here is structure. Anybody can name this structure? This vessel curves around the corpus
Anterior
callosum.
cerebral artery.
Yeah, exactly. Thank you, Muhammad. This is the anterior cerebral artery, correct. So this was the lateral view. Now this is a more zoomed picture, angiography. Anyone can name the number 5 structure? We have 2 of it. This is on the left, this is on the right.
Two vertebral artery.
Sorry, شنو طيبة?
Two vertebral artery.
Okay, but this is not a vertebral artery. You can see distally, it bifurcates into a big lateral division and a small medial division. So what is it?
ICA is possible.
Internal carotid artery.
Yeah, exactly. This is the ICA on the left side, and this is the ICA on the right side. Number 4 is the MCA. Can you name the segment? What segment of the MCA? Number 4, here, or even here.
We have the sphenoidal segment, the insular segment,
correct.
the
Which
opercular
one?
segment.
You're naming them all. I said which
is
segment
this
is this?
This is the sphenoidal segment before the bifurcation.
Yeah, exactly. Exactly. Thank you very much. What is number 3?
Anterior
What segment?
artery.
It's not a communicating. You're close, but not communicating. What segment is this?
The infracallosal. No. Sorry.
So you said it is
it's
A2? It could be A2 or A3, yeah. This is the communicating.
May I discuss this with you?
Yeah, please.
The anterior communicating artery, before the anterior communicating artery, there is the A1. After the anterior communicating artery, there is the A2.
Yeah.
And believe after it, it's the A3. Maybe this is the A3.
Yeah, correct. It could be like this or that. And you can see how they are twisting the two ACAs on each other. They are not walking side by side, running to go up and turning on the between the hemispheres on the medial surface of the brain. They are twisting on each other, and there is a variation also on this topic. Indeed, the left one on the right or the right one on the left. Which one anterior? Which one posterior? So they are not side by side, one above the other, in real human brains, not in textbooks. Okay, thank you. Let's see what else we have. This is an MRA, magnetic resonance angiography. Anyone can tell me what is this segment called, and which artery is this?
It should be the
insular
muscular
segment.
segment.
Insular segment. Who said it? Muhammad?
Hello.
Taha or Muhammad said the insular segment.
شنو السؤال؟
Which segment
insular.
is this? Okay,
The
correct.
insular. إيه.
Thank you. It's the insular segment, correct. And this one?
نسيت اسمه اللي هو
The opercular.
horizontal. ايه صح.
Correct, the opercular segment. What is this segment?
The internal carotid artery.
Yeah, this is the artery, not the segment. But which segment of the ICA is this?
Ah,
This has a hump anteriorly.
cavernous, the cavernous.
Yeah, exactly. Thank you very much. Yeah. Let's see what we have. Anyone can name this imaging? Anyone have an idea or heard of it or ever seen it? What we call this imaging?
Computer tomography 3D, CT 3D.
Yeah, but one more word, please. One more word to be perfect. What is it?
Angio?
Yeah, angio. 3D reconstruction angiogram. Yeah, CT scan. So here we have the right ICA. This is the left ICA. This is the MCA. This is the bifurcation. This is the superior division, inferior division on both sides. And here's the ACA. I'm sure you're familiar with such imaging with Dr. Muhammad. Anyone can tell me or describe this section for me? Just description. What do you see? Yes, please.
May I?
Yeah, go, Mahmoud.
Enhanced CT scan, axial section. That's it. And,
contrast or without contrast?
With contrast, enhanced.
Yeah, with
Yes.
contrast. This is the
It's
middle
showing
cerebral
the-
arteries.
Yes.
Yeah,
This is
and this is the ACA.
ACA. Yes.
Yeah. Can you name the pathway in which the MCA passes through? Here, what we call this pathway?
Sylvian
This
fissure?
tunnel. Yeah, correct. So here's the Sylvian fissure lies. Okay, do you have an idea what's this? I know it's not related to our topic right now, but what do you call this black structure? Just behind the midbrain.
It's a
This is the
cistern.
midbrain. Yeah, what's the name?
Quadrigeminal cistern, no?
Yeah, exactly. Quadrigeminal one. Which part of the PCA passes there? Don't tell me the quadrigeminal segment. I know it.
The third.
P3. Okay, I want from this picture only to tell me what is this structure. I'm pointing.
Basilar.
Yeah, basilar. Correct. Now, I think this is going to be the last one. Tell me, what is this? This is also an MRA, magnetic resonance angiography. Tell me, what's this?
P1?
P1, yeah, correct, the P1 segment. And thank you very much. I hope you enjoyed it. If you have any question, please don't hesitate to ask. I hope you had a nice experience in the vascular world. This is a very basic presentation. I'm sure we will make more presentations on the vascular chapters. Please, I'm listening if you have any questions. While you're thinking or writing your questions, here are some references I used. This is the Roton Cranial Anatomy and Surgical Approach. This is a micro neurosurgery, and some of the pictures from the netters and some online Radiopedia. Many references, but the text that I counted on is the Roton. Yes, please, any question? I'm listening.